to give up until they're cleared of a drug charge. They're asking Governor Bob Martinez for a pardon. Kenny Jenks, a hemophiliac, received AIDS from a blood transfusion. Now his wife Barbara has it too. They say marijuana relieves nausea and other side effects from their AIDS-fighting medication and increases their appetites, making them stronger. Police don't see it that way. They arrested the couple in March for growing pot at home.
We could die without clearing our names. You know, there was no, didn't have any criminal intentions. We just wanted to survive is all.
The Jenks are asking the people of Florida to contact the governor's office and support.
Disease now finds themselves fighting the law.
That couple is infected with the AIDS virus, and they say smoking marijuana alleviates side effects of their AIDS-fighting medication. But their arrest on drug charges is prompting them to speak out on the controversial use of marijuana as medicine. Marie Rhodes has the story in tonight's News Extra.
Kenneth Jenks contracted AIDS during a blood transfusion and passed the virus to his wife Barbara. The anti-AIDS drugs they took made them sick.
Oh, you'd get up in the morning and get sick, nothing, you couldn't eat. I mean, it was just unreal.
They tried marijuana at the suggestion of other AIDS patients.
But smoking the marijuana has helped the nausea. It's helped me eat. I gained my weight back.
The Jenkses say they prefer the direct effects of smoking marijuana cigarettes, which are illegal. However, THC, the active ingredient in marijuana, has been available legally to doctors for some time now, but it's prescribed only rarely. Research at the University of South Florida in Tampa shows THC can ease nausea in some cancer patients on chemotherapy who don't respond to alternative drugs.
I don't know of any medically related benefits to the general population. The medically related benefits are really associated with individuals who have some type of a medical problem.
Since the late 1970s, marijuana cigarettes have been prescribed to treat some cases of glaucoma, fluid pressure in the eyes. But the federal government has approved only a handful of prescriptions. Robert Randall is one.
But there are all sorts of drugs that are used in medicine that can be abused. Seriously ill patients should not suffer as a result of someone else's misuse of a drug.
We don't feel that we're doing anything wrong. We're just trying to survive.
The Jenkses say there's a chance they won't live to see the end of a fight with the government. They say they just don't want to die as criminals. In Tampa, Marie Rhodes, News Center.
People are saying yes to marijuana. There are people who are sick and they say they need pot to treat their illness. Should the law be changed so that marijuana can be used legally for medication? Well, Denise White is here now to take a closer look.
The law says that marijuana has no medicinal value, and with only a few rare exceptions, it can't be used legally to treat an illness. But there are some people with glaucoma, cancer, AIDS, or multiple sclerosis who say marijuana eases their pain and suffering. They want the government to reconsider and turn over a new leaf. Across the country, drug agents swoop down on fields of marijuana. But even as they're destroying the plant, a number of people say we should be growing it for medical treatment.
I wouldn't be here today if it wasn't for smoking it.
Yeah. Kenneth and Barbra Jenks have AIDS. The couple says they smoked marijuana to get rid of their nausea until they got busted by police. The Jenks say when pot can be used for medication, it should be legal.
Not everybody takes Valium, not everybody gets codeine or morphine, but doctors can write those types of prescriptions. It should be between the doctor and his patient. If he decides that marijuana can be a benefit, he should be able to write a prescription.
Marijuana prolongs the eyesight in glaucoma patients. It treats nausea in cancer and AIDS patients, and it prevents spasms in people who have multiple sclerosis. There is a legal version of marijuana that's prescribed on rare occasions. Marinol is the synthetic form of THC, the active ingredient in pot. But a few glaucoma patients can legally smoke the real thing, marijuana cigarettes. Robert Randall was the first to get FDA approval. The paperwork can take months or years, and most people are turned down.
Why is it that my glaucoma, for example, can be treated with marijuana, yet Kenny and Barbara, who are dying of AIDS, can't get marijuana legally? We find that to be a frightening situation.
When asked why marijuana can't be prescribed routinely, The Food and Drug Administration will only tell us that no drug company has asked for it. The few patients who can legally smoke pot are trying to drum up public support. Meanwhile, the Jenks are still waiting for FDA approval. It's been 4 months. They aren't sure how much longer they'll be able to wait. We asked if they're desperate enough to use it anyway.
Well, we've just tried to do what any sane person would do in our, we're just trying to survive.
The Jenks are on probation, and they must do 500 hours of community service work for growing marijuana. They have asked the governor to pardon them. And the Jenks say they don't want to die with criminal records because they don't believe they have done anything wrong.
Is there any indication that they'll be getting or have access to the marijuana anytime soon?
No, there are less than 10 people in the entire country who can smoke pot legally for medicinal purposes. And also there are some doctors who believe that there are other medical options.
Okay, thank you very much, Denise.
I've got to smoke marijuana. I've got to. If I don't, then I'm gonna die. I'm gonna die anyways, but I would like to have my life a little bit longer.
24-year-old Barbra Jenks has AIDS. She, along with her husband, Kenneth Jenks, who also has a terminal disease, face various marijuana charges. Kenneth, who suffers from hemophilia, says he contracted AIDS from tainted blood during a 1980 transfusion. The couple testified that smoking pot has helped prolong their lives. Under oath, each claim marijuana is the only drug they found that reduced nausea associated with AIDS. Another problem experienced by sufferers of the fatal disease is rapid weight loss. Kenneth Jenks said that marijuana helped in this regard.
So I tried it first, and gosh, about an hour after I tried it, I was eating everything in the house. And then my wife, she got over her reluctance, and the next night she tried it, and God, her whole life changed. It would change for the better.
The non-jury trial is before Judge Clinton Foster. Foster told defense attorney John Daniel that permitting the couple use of pot might open the floodgates. The judge said he's concerned that others with all kinds of ailments would want access to marijuana. Foster said he would hand down a decision in the Jenks case within the next few days. Mike Gerspan, 13 Eyewitness News. Today, Judge Clinton Foster described Ken and Barbra Jenks as victims of a horrible chain of events. Ken, who is a hemophiliac, contracted AIDS through a blood transfusion. He then passed a deadly disease to his wife. Last spring, the couple was arrested after investigators found a marijuana plant in their Panama City Beach trailer. The Jenks claim that marijuana is the only drug that reduces nausea and vomiting associated with AIDS treatment, but Foster said he was not satisfied with proof of that claim.
As a matter of great public concern which should be addressed by the legislature as a matter of public policy instead of by the courts. The court therefore finds the defendant have failed in their defense and that they are guilty of the offenses charged.
In an unusual move, Foster sentenced the couple to 500 hours of community service. That will consist of each taking care of the other. Although found guilty, Ken Jenks feels the trial was well worth it.
Actually, if there's people out there that have, tried the available drugs, and instead of giving up, if they find out marijuana can help them, maybe actually it'll do someone some good. We could have gave up a long time ago, and I don't believe we'd be here today.
I don't believe I would be.
Unless you're standing in our shoes, you just got to make that choice.
The attorney representing Ken and Barbra Jenks says today's verdict does not end the case. John Daniel plans to appeal it to a higher court. Daniel says he hopes the First District Court of Appeals will throw out Foster's ruling. He says doctors should be given the option of prescribing marijuana.
We let doctors prescribe morphine, heroin derivatives, all these other high-powered medications. Why the devil should a cop or you have to go out and buy it on the street.
Mike Ruspan, 13 Eyewitness News. Time to bait a hook and cast a line. This afternoon, Ken and Barbra Jenks enjoyed fishing, a far cry from their hectic schedule of appearances on television talk shows in many of the nation's largest cities. Last summer, the couple, who both suffer from AIDS, were convicted on marijuana possession charges. In a Bay County courtroom, Ken and Barbra testified that they need pot to reduce the nausea and vomiting caused by the deadly disease. The judge sentenced them to take care of each other. In light of their circumstances, the Jenks do not feel they're guilty. They've appealed to Governor Martinez for a pardon.
Arrest and being put in jail because you were arrested trying to survive, and they're trying to take a drug away from me that I need and I can't do without.
For months, they've been waiting on federal permission to use marijuana for medical purposes. With the deadly virus, Ken says they only have so much time.
And I think, it should be between the doctor and his patient of whether or not marijuana could be of some help. That shouldn't be decided by a policeman.
Barbra Jenks urges people to write to their state and federal representatives to lobby for medicinal use of marijuana by AIDS sufferers. Mike Ruspan, 13 Eyewitness News.
For the prosecution, it's a simple case of drug possession. But for Barbra and Kenny Jenks, marijuana isn't for stimulation, it's for self-preservation.
I fully believe without marijuana, my quality of life is going to deteriorate and I will die. And I believe my wife will die too.
28-year-old Kenny Jenks and his 24-year-old wife Barbra are dying of AIDS. He is a hemophiliac who received a blood transfusion tainted with the AIDS virus and ultimately passed the infection onto his wife. But the drugs that treat AIDS cause side effects nearly as painful as AIDS itself.
Because it controls my nausea, it controls my muscle spasms that I do have, and my nerves. I eat. If it wasn't for smoking marijuana, then I would just waste away.
Whatever relief marijuana brings, it's still against the law. And police in Panama City, Florida, acting on a tip, burst into the Jenks trailer home in March and arrested the couple on charges of possessing 2 marijuana plants.
Gosh, our whole life, they destroyed our whole life.
For years, there has been debate about the therapeutic use of pot. Robert Randall heads the Alliance for Cannabis Therapeutics. He smokes 10 joints daily to keep the effects of the blinding disease glaucoma at bay. But he fought with the government for 3 years to win the right.
Yeah, the seriously ill have become unintended casualties in the war on drugs. We're caught in the crossfire.
34 states have passed resolutions to make marijuana available to the sick, but the Drug Enforcement Administration is opposed to reclassifying the drug so doctors can prescribe it. Physicians are caught in a bind, even though many studies show the drug is useful.
What it's going to do is improve the patient and help them feel better. And it's going to relieve their nausea and vomiting. It can stimulate their appetite.
Other experts say medical marijuana's risks outweigh its benefits, and that making it more available could put pot into the hands of drug abusers. Synthetic marijuana in pill form has been an unacceptable substitute for many. If the Jenks are found innocent, it could set a precedent.
Where does the court draw the line? Suppose I get a case in next week, the fellow has a severe back pain.
But the couple's lawyer says it's a matter of medical necessity for them. Whatever the outcome of the Jenks case, the controversy over the medical use of marijuana will continue. The question is less over the drug's merit than how to get it to those who need it legally. Jeff Levine, CNN, Panama City, Florida.
Lots of people have been arrested and gone to jail for using and even growing marijuana here in Florida. Well, next up in the Florida Spotlight, I would like you to meet a couple with a story the likes of which you've probably never heard. Here in the Florida Panhandle, they have been using marijuana to relieve their pain and suffering from a fatal disease which both of them share. But the law is the law, and for this, they are criminals?
Justice and right have something to do with each other, I believe, and I don't think these folks have been treated right.
John Daniel is one of Panama City's most respected defense attorneys. But when his clients, Kenny and Barbra Jenks, shook his hand and left the Bay County courtroom several weeks ago, they left convicted of a serious felony. Long before they landed in court, Kenny and Barbra were victims of a string of tragic circumstances. He is a 28-year-old hemophiliac, a bleeder, someone who has needed to take extra blood products all his life. Sometime, somewhere, some of the blood he got was tainted with the AIDS virus. And before he even found out, almost 2 years later, he had passed the deadly disease to his young wife. For reasons doctors still don't know, she got sicker quicker and ended up in a hospital near death.
He was extremely short of breath, nauseated to start with, losing weight, having night sweats, chills, could not sleep, could not eat. He was deteriorating very fast.
But the doctor says, like in many such cases, side effects of the strong drugs she needed made her almost as sick as the disease.
The treatment by itself was extremely toxic to her, causing nausea, vomiting, allergy, rash, more weight loss. So you can imagine that we complicated an illness by treatment.
All of the doctor's other patients in that same shape have died within 2 years. But 2 years later, her doctor says...
Barbra looks great. She's turned around favorably. I honestly felt that Barbra wouldn't be around for 6 months to a year. And it's a miracle to see her doing so well at this point.
It was in the midst of misery, after she was finally out of the hospital, that Barbra Jenks says she and her husband found their own miracle medicine, something far more effective than anything Dr. Ortega or his colleagues at the hospital could provide. But the only treatment that seems to relieve the terrible side effects Barbra and Kenny suffer from their AIDS medication is more than unconventional. It's against the law.
I'm not saying try it, but I smoked a marijuana cigarette, and it's like it just took it all away. It took the nausea away. I was able to eat. The disease itself gives you nausea, but the medicine that you take, like the AZT and the betamidine that they give you, is more nauseating than the disease.
But if you don't take the medications, then you know, you've got nothing to fight the disease. I mean, you're just going to waste away.
I used to carry a bag around with me because,
she would throw up. She'd literally have to carry the bucket in there and set it beside the couch because she couldn't make it.
Barbra is better. Compared to the first day I saw Barbra, this is a new woman now.
But after they started growing their own marijuana medicine inside their Panama City Beach mobile home, somehow the police found out. Armed with a warrant, Detective Tom Harris and a narcotics task force stormed in late one afternoon.
Well, we found the marijuana plants growing in the back bedroom.
How many?
I believe there were 2.
2 plants?
That's correct.
Well, it wasn't only a bigger bust, was it?
No. Yeah, we go after pot, cocaine, anything aggressively. Yes, if it's against the law, we do.
Any amount?
Any amount.
State Attorney Jim Appleman's office took the same hard line to court and won the felony convictions after the Jenks told the judge the same story they've just told you.
So you're felons?
Well, but the judge withheld adjudication of guilt.
I'm not a criminal. I'm doing something that is saving my life. I mean, there's a big difference there. I'm not a criminal.
But you broke the law.
We did break the law, but, I mean, we didn't have any alternative. I mean, at that point, what do? Give up?
The decision was that I'm dying. Marijuana can help prolong my life. It's illegal. Should I break the law to get the marijuana I medically need? Absolutely. Any sane person in your audience would reach that decision.
Robert Randall has fought this fight and now gets legal prescriptions for marijuana provided to his hospital pharmacy by the U.S. government. He gets them in regular little prescription bottles. They look like non-filtered Camels, but these Camels have not just more kick. Robert Randall and his doctors have convinced the courts in Washington that his use of marijuana has had a profound effect on his glaucoma, an eye disorder.
If it weren't for marijuana, I would be introducing you to my seeing eye dog Rex. So I still have my eyesight because of marijuana. Kenny and Barbra Jenks' doctor knows they should have marijuana. He cannot simply sit down and write a prescription. Instead, he has to go through a complex bureaucratic procedure dealing with 3 different agencies in Washington, D.C. It's now nearly 4 months since he's made that application, and we have 2 young people who are literally dying in the public eye while federal agencies do nothing.
They had an avenue to go through that they could have utilized, yes. It may take them a long time.
And they may be dead before it happens.
And they may be dead before it happens.
Too bad.
But there is a procedure that you must go through.
I'm talking about people who are dying of a disease that is not curable, and we want to relieve their pain and suffering. We can't use discretion to be compassionate, just to help someone who's dying?
Sure, in the sentence. That's where the compassion came.
And send them to their graves convicted criminals?
Essentially, you're sitting there with a circumstance of you have a violation of the law, and you have to look at that circumstance from the standpoint of, what about others?
Judge Clinton Foster was sympathetic in his sentence. He gave the Jenks 1 year unsupervised probation, withheld court costs and fines, withheld adjudication of guilt, and ordered 500 hours of community service to be discharged only by their providing care, comfort, and concern for each other. But they remain convicted of a felony, and neither has ever been arrested for anything else in their lives. If the convictions are not overturned on appeal, only the governor and the clemency board can clear their names, and a pardon is very important to them.
These good people, they don't want to die as criminals. That's why it's important.
I'm not giving up. Because I don't want to see somebody else in the same spot as what we were put in. And if it's the last thing I got to do, then fine. I'm perfectly happy at doing it.
The State Parole Board and Governor Bob Martinez could conceivably commute Kenny and Barbara's sentence before he leaves office. Otherwise, Governor Childs, what will you do?
Speaking of illegal activity, only at AM Philadelphia would you get a chance to see this particular prescription bottle. The writing is so small there's no point in holding it up, but it is written to Robert Randall, and it says, "Smoke is directed." Smoke what? This is a marijuana cigarette, a legal marijuana cigarette. In just a moment, you're going to meet the man who's the first person in the United States to win a court battle and legally, for his glaucoma, get to smoke this cigarette. It's a prescription, and I have to tell you, it's kind of strange to look at a prescription bottle from Washington Hospital Center Pharmacy for Robert Randall. It's got a prescription number on it, and it says, "Smoke as directed marijuana cigarettes." The point is that for some people with some illnesses, marijuana seems to have, for some reason that doctors really don't quite understand, some therapeutic powers. I want you to meet a married couple, Ken and Barb Jenks. They come to us from Florida. Unfortunately, the thing that brings them to our attention is the fact that they both got AIDS. He is a hemophiliac who got it through a transfusion. How long ago, Ken?
Approximately 1985.
Okay, 1985, and you and Barb have been together for how many years now?
8 years.
8 years altogether. You found out you had AIDS how long after the transfusion?
We were told in '87 that more than likely we're infected, and then my wife became seriously ill in December '88.
'88,
Okay.
and I was diagnosed in '89, and so was he.
So you got it through the transfusion, and then through sexual transmission you got it?
Yes.
You both got AIDS?
Mm-hmm.
How many troopers bashed in your back door to come and get you?
Gosh, when the police came, there was at least 10, I think 12. And they used a battering ram.
I would say about 12.
And our trailer door opens out, and they smashed it in. And what they found was we had 2 small marijuana plants, possession of less than 20 grams.
What do you need the marijuana for?
To control our nausea. There's a lot of aches and pains involved with the wasting.
To keep our appetites up. If you smoke pot, you're going to get hungry. You know, I mean, it just keeps your appetite up. And
did you ever, Ken and Barb, did you ever smoke pot before?
I had tried it when I was young, but I didn't really fool with it. She had never
I had never tried it.
You never tried it. Who was the one that got you to start?
Well, we met, we were having trouble with weight loss. She went from 155 pounds down to 112 pounds. And we met a person through an AIDS group, and he told us that smoking marijuana helped. and he gave us some, and we tried it, and in the year that we used it, I went up to 150 pounds, which I've never weighed, and her weight went back up to 135 pounds.
Now, do either one of you have full-blown AIDS?
I do.
You do.
Mm-hmm.
And you test positive for the virus?
I test positive and have a few minor infections, you know. Nothing. Okay. I haven't been hospitalized so far.
So this being the situation, now obviously Florida is a state that's got a real significant, well, they all do, Florida especially, has got a real significant drug problem. Mm-hmm. Are you all kind of swept up in that?
I believe so. I mean,
I believe so.
It was clear we didn't have enough marijuana hardly for ourselves, let alone to, you know, to sell or anything. And, you know, we just...
But you got found guilty, though.
Oh, we did.
A judge found you guilty.
He was compassionate with his sentence, though, because he gave us 500 hours of, you know, caring for each other.
Okay, help the parent who's compassionate to you and says, gee, I'm sorry you had a bad blood transfusion. I'm sorry you got it from him sexually. I'm sorry you've both got AIDS. But there are 13 and 14 and 15-year-old kids out there that we have to protect. Therefore, the law has to be ferocious on this marijuana business.
No, I don't believe so, because a doctor should be able to sit down and write a prescription for pot, like he does any number of drugs.
Does your doctor want you to take pot?
Yes, he does.
Yes, he
does
does.
apply through the IND process for us to get legal access to it. He knows it works. And he has a number of patients that, if our papers eventually get through, he'll put them through the system.
Do you take pot now?
Oh, gosh, I can't hardly. We're just trying to survive.
What would you do?
What
would a sensible person do?
Any sane person
would try to do what they could to survive. You know, we tried a number of legal drugs was a problem, over half a dozen, and none of them didn't work, or you just can't function.
Are you, either one of you, yet comfortable with the random and the freakish way that this thing came into your lives? I mean, what are you both, 24, 25 years old?
I'm 24.
I'm 28.
One would look at you as a couple and say, my God, they've got everything to live for. They got their whole lives ahead of them, probably wanted a family and everything, and now this. Have you gotten past the point of why did this happen to me?
Oh, we got past that after we got arrested.
Did you?
Yeah.
Yeah, we just, for the longest time, you know, it was a nightmare whether or not we had it, and then when we knew we did, it was, you know, at least we didn't, at least we knew, you know, and now
it was hard
we've been dealing with it. I mean, it's, I don't know.
So your anger's almost kind of channeled into this whole marijuana thing.
Yeah, we would like to see it rescheduled.
Okay. Well, tell you what, we'll take a break and we'll come back, we'll start taking your phone calls. The question is, as legitimate as their claim is, and as certainly legitimate as their pain is, what do you think? Should we legally give them the right to use marijuana to alleviate that pain? We'll take your phone calls, and also, as I said, and as we promised, the first man in this country legally allowed to smoke marijuana. Don't go away. Welcome back to AM Philadelphia. As we told you a couple of moments ago, this is it. This is a legal marijuana cigarette. The man to whom it belongs is Bob Randall. He is the first man in the United States of America to get permission to smoke marijuana. He has serious glaucoma, and when he smokes marijuana, it eases the pain. We'll talk to him about that in a second. I look at these, and this is such a strange sight, this bottle. If you have your way, is the glaucoma sufferer or the cancer patient going to go down to the Pathmark Pharmacy and get this, or how does this happen?
Absolutely. There are hundreds of thousands of people in this country who have marijuana-responsive diseases, whether it's AIDS, as we've just heard, cancer, glaucoma, multiple sclerosis, or paralysis. All of those groups can, in one way or another, benefit from marijuana. Now, the decision about whether marijuana should be used should be between the doctor and the patient. But certainly if the doctor and patient agree that marijuana could be helpful, that drug should be available by prescription instead of off the street.
In the same sense that a doctor would write a prescription for an antibiotic or for some other kind of medicine, you want the doctor, the family doctor, whatever, to be able to write a prescription for marijuana?
Yeah, I think medical care should be in the hands of doctors and not policemen.
What is the reality of, for example, in Pennsylvania and Delaware, there is no such law.
That's right.
So if you have cancer, if you have AIDS, and marijuana relieves the symptoms, you have to get it off the street.
You either have to get it off the street or your doctor has to go through a process that's so complex that you'll probably be dead before he ever gets the medicine to you.
Last question before we take the phones. When you use marijuana, first of all, you use it when the pain of the glaucoma starts?
Yeah. Essentially, glaucoma is a condition of pressure. There's not a lot of pain, but I know exactly when my pressure rises during the day. This can be charted out. And so I simply use marijuana based on a prescription to meet that time.
How often do you use it?
I smoke 10 marijuana cigarettes a day. Have done that for the last 14 years.
Now, what about the business of getting high?
You don't get high if you smoke a large amount of marijuana continuously and it's the same quality. And for glaucoma, it's not necessary to get high. If you have a condition like AIDS or cancer, the high is actually helpful.
Okay, let's take some calls. Hi, you're on the air. Go ahead.
Hello, everyone. I'd like to say that I think if this prescription helps alleviate any chronic illness that anyone has, it should be available to them. Because I have a chronic illness myself, and I know that the prescriptions I get are ruining my liver. But if someone was to tell me that smoking a stick of marijuana would help alleviate the burning and the pain that I have in my liver, I wouldn't care what the government or anyone else said. I would be trying to get some type of relief for myself. Because as far as that goes, anyone, any chronic illness, we don't even know. There hasn't been even enough research to know that it might help some other problem also.
I think she's making a very good point. What she's saying is that conventional medications that doctors prescribe every day are incredibly dangerous medications. And certainly we can trust a doctor to prescribe something like marijuana.
A number of the legal drugs they gave us were horrendous. We couldn't function.
Are either of you on AZT?
Yeah,
we
that's
both
no
are.
picnic.
And that
AZT
affects
is-
your liver too.
Yeah, it does.
Most of the drugs that you
your
take
appetite, your just well-being. I mean, it's no picnic, not in the least bit.
Hi, you're on the air. Go ahead.
Well, hi, I'm calling because I agree completely with your guests on the panel. I had a cousin who passed away of breast cancer at the age of 38. Unfortunately, she was in an awful lot of pain at the end, and she could not eat because of the chemotherapy making her so sick, and they had to resort to buying marijuana on the streets for her to get it. I think it's pathetic in this country that they are more concerned with a drug that can help people, and as the previous caller stated, the side effects of some of the prescription drugs that doctors are prescribing. Another little bit of an aside, I know, in fact, a patient that we had once in the hospital who was terminally ill with cancer. The doctor wrote for morphine as needed for the patient, and one day when he was making rounds, patient screaming in pain in the room, and he asked the nurse why the orders were not being followed, and the reply was, well, we don't want to get her addicted. Now...
And she was dying?
Yeah.
Pardon?
She was dying.
She was dying, yes.
Yeah.
Now, it makes you wonder where people's values are and what is really going on.
Yeah, I think our values have become very skewed. We're so concerned about drug abuse that we're not providing drugs to people who seriously need them.
But let me play just for a second devil's advocate with you. Let's say your doctor, your ophthalmologist says, Bob, congratulations, we have just discovered some kind of laser surgery that will relieve the pressure of glaucoma, and if you have this operation, it will relieve that pressure, no longer necessitating your need for marijuana. I gotta believe, wait a minute, no. If you've had 10 marijuana cigarettes a day for how many years?
Oh, 15.
People, you're addicted.
No, it doesn't work like that. And
Why
even
not?
if it did
Why
work
not?
like that, it wouldn't matter.
You're
15 years...
You're telling me your body wouldn't miss 10 marijuana cigarettes a day?
No, my body would not miss it. Any more than it would miss the other medications I have to take. It would be a great relief to be disease-free and drug-free. But I have a disease, and I need drugs. It's the only way I'm going to maintain my sight. Just as Kenny and Barbara need drugs in order to maintain their lives. If they don't have marijuana, they are going to lose their weight, and they're going to get... That's right. They're going to get into a situation where they're essentially going to die.
Okay, what do you think? More phone calls as we continue with AM Philadelphia. What a paradox that the people who seem to need it can't get it, and the people who we don't want to get it can get it like that. Stay with us. Welcome back to AM Philadelphia. Thanks for holding on. You're on the air.
Good morning. This is Gigi calling. I would like to say this is the best program I've seen in years. I agree with everybody. I have fought for the use of marijuana within my own family. I am an adult of childhood sexual molestation. I have been committed for it. There were periods of depression. I was also an anorexic. I mean, so thin that I was wearing a 1, okay? Couldn't sleep. All I had time to do was to worry. I was a single parent. A friend, and this man saved my life as far as I'm concerned, gave me a marijuana stick because I had been bleeding from the rectum. I had also, my period was a day or 2. My muscles in my arms could not move. They hurt because I was so thin.
What about now?
Now I am a very productive person. I have a job. There are bouts of depression, and I do smoke marijuana from time to time to bring me up.
What does your doctor say?
My doctors, they all don't like it.
Right.
They don't like that I'm using marijuana.
Okay, let me stop you just for a second. I'm not saying that all these wonderful things that have happened into your life because of marijuana,
No.
I'm not saying that those are not very real. But before we run up the flag too high for marijuana, how many people get stoned and go wrap their car around a telephone pole?
You're right.
How many people get stoned and do move on to other drugs? I mean, what were you saying? In some cases, if you can't get marijuana, but they'll be happy to sell you cocaine, right?
People tried to do that. They tried to sell us cocaine.
But we refused them.
I mean, cocaine was easier to get than marijuana. All we wanted was a bag of pot.
To the caller, real quickly, where do you get your marijuana? Obviously, I don't want the name, but do you get it off the street?
Yes, I do. And I've really wanted to ask doctors. I had a psychiatrist who, in fact, knew that I would have insomnia. I couldn't sleep. I couldn't eat. I'm nervous. And she wanted to put me on antidepressants. Now, one doctor did put me on antidepressants, and it didn't work. It kept me so down, I couldn't do anything.
Right, okay, I understand. I got to tell you, you're a whole show. But the bottom line is that marijuana has made a big, significant difference in your life.
At times, and I don't smoke it constantly.
Okay.
That's true, and I have been off of it for a year.
We wish you well, and we thank you. How furious are you at this? And is maybe the anger about getting AIDS and getting it in such a random fashion, is maybe that anger being channeled into this?
I believe so. I feel that, somebody's got to start somewhere and make a difference. Do
you feel, though, because you both have AIDS, and maybe your time is limited, that by God you're going to do one thing before you get out of here?
Or at least
if this is going to be the last thing I'm
going
to do, then I'm going to do it. If I can help another patient, not necessarily with AIDS, but if somebody with cancer or MS, then I'm going to try and help them the best way I can.
Well, we wish you well. We're glad you came here. Barbra and Ken Jenks, both of whom have AIDS, and Barbra has cancer, and they elaborated pretty well their story about why they feel marijuana is for them. Bob Randall, the first American to legally be entitled to smoke it for his glaucoma. We thank you, sir, for your contribution and also for bringing the stuff here to show our audience what it looks like when it's legal. Stay with us as AM Philadelphia continues.
Kathy, we'd like to welcome our first two guests. We have with us Kenneth and Barbra Jenks, and of course you may know their names. They've been in the news quite a bit over the last few months. They are both having been diagnosed as having HIV positive or having the AIDS virus, and up until a few months ago had smoked marijuana to help alleviate the pain from the pain of the symptoms that they had from marijuana. From AIDS. Thanks very much, both of you, for being here. We appreciate you coming in. First of all, when, where, and how, if you know, did you both come in contact with the AIDS virus?
Well, approximately 1985 is about when they figure I got some bad blood. And then in 87, my doctor started telling us, that there was a chance that a pretty good chance we were infected. But when not until my wife became seriously ill in December of '88, that's when we, you know, found out that she had the AIDS virus, and I did also.
How do you think you contracted it, Barbara?
I got it through sexual contact. My husband is a hemophiliac, and he got it through a blood transfusion.
Okay. And I passed it on to her.
Where was the blood transfusion given, do you remember?
Bay Medical.
At Bay Medical Center.
Yes, ma'am.
So it was here locally, okay. When did you realize that marijuana would help alleviate the symptoms from AIDS?
I knew that after we were at this group, and it's this group that we go to with other people that have it. Mm-hmm. We had met somebody there, and they had, got to talking, and after I had full-blown pneumocystis pneumonia, somebody had told us about it. They told us that it controlled the nausea, and it helped you eat.
Because her weight had, my wife's weight went from 155 pounds down to 112 pounds. And I was starting to lose weight also, because we were using AZT and pentamidine and a number of other drugs. And when we started using marijuana, my wife's weight went back up to 135 pounds. She gained 25 pounds. And I went up to 150 pounds, which I've never weighed.
What about the other side effects of marijuana that makes someone lazy and lethargic and not caring about life?
You just described most of the side effects from the drugs that they give us. Marijuana seems to alleviate those side effects. AZT is like that. AZT is, it's one of the hardest drugs. I'd say marijuana is the safest drug that we've ever used.
In the last court, go ahead, Tom, I'm sorry.
No, that's all right.
In the last court battle that you fought, I know that you were found guilty of the marijuana. What was the punishment? What did they give you?
They gave us 500 hours of community service for loving and taking care of each other. He found us guilty, but he withheld the adjudication. Gave us a year of unsupervised probation.
And we're currently appealing it.
Yeah.
And you're appealing that?
Yes.
It sounds like the judge went somewhat easy on you, and very compassionate in the situation, but still he, I guess by the ruling, he has kept you from smoking marijuana. In other words, he said it's still illegal for you to do that, right?
Yes, he has said that. Our doctor has applied through the IND process to FDA and DEA to gain legal access to marijuana. We've heard from one agency, but we're still waiting to hear from the other.
But we know they've both received the papers.
Yeah.
Okay. Who is your physician?
Our physician is Dr. Thomas Sonnenberg in Pensacola.
Okay. Now, prior to the ruling, or prior to it being found out that you were using marijuana for your symptoms, how did you go about getting it? Did you grow your own? Did you go to the streets to buy it? I mean, how did you go about getting marijuana?
Well, we got it off the streets when we could, but a lot of times you just can't find any. And so at that point, that's when we decided to grow our own. And we grew 2 small plants. And when we were arrested, it was for possession of less than 20 grams. And we barely had enough for ourselves.
Who would turn you in for something like that? Do you know? Do you suspect someone?
I don't have the slightest idea. The police gave us a name, but we don't know the name. Nobody we know does. Evidently, they just pointed our house out and said, I know they have marijuana in there, and next thing we know, the police came.
From the amount that was confiscated, I would say it's pretty obvious that you had no intent of distributing it. It was strictly for personal use. When you just made the decision to go ahead and start using marijuana, did you ever think at all about the legal aspects of it, or was your health more important?
Well, we were worried about our health. I mean, when you're just literally wasting away, and we tried a number of legal drugs as a thing. We tried over half a dozen, and they just didn't work, or you couldn't function under them. You end up laying on the couch and just kind of in a stupor. And we told our doctor at the time that we had flushed them down the toilet. That we had started using marijuana and it worked. And he understood that. He knew that it worked, but he couldn't come out and tell us to do that. But he was aware of what we were doing.
You said you had group meetings. Are there other people with AIDS in our community that you gather together and you unite as far as feelings?
Oh, it's growing here in Bay County.
The AIDS population is
getting
growing.
bigger.
Without naming names, obviously, do you know of other people who are using marijuana to alleviate the symptoms?
Oh, yes.
Oh, we've met so many now we can't count. I can't count how many we've met.
Are you working?
No, I'm not. I'm on Social Security, and we are trying to get his Social Security.
Yeah, I've been
disability.
denied twice. I'm on my third appeal for Social Security. She gets $454 a month, and we get $140 in food stamps.
So you're living off roughly $700 a month?
No, not even $700.
700, yeah.
About $600 a month.
Not even $600, if you think about it.
Yeah.
One more question, because we're just about out of time. Where does your case go from here? You're in appeals right now. There's probably not much you can talk about, but what can you tell us?
Well, they've applied with the First Court of Appeals in Tallahassee, and they've asked for an expedited appeal, and we're waiting to hear from them now.
One more quick question from me, please. If you were living in California or somewhere that the lifestyle is freer and not so judgmental, do you feel like that possibly a move would be better for you for the rest of your lives?
Why should we have to move for them, though?
Yeah, we shouldn't have to move to get medical
I'm
care.
just as perfectly happy here.
Yeah, we like Bay County. The way we feel is a doctor should be able to sit down and write a prescription for marijuana as he would any drug. I mean, they write prescriptions for morphine, Valium, codeine, and marijuana is far safer than any of those drugs.
Okay.
I must say it's been a pleasure to meet both of you.
Yes, thanks very much, both of you.
Thank you.
Thank you.
Of course, we'll be following this case more as the developments occur.
We'll be talking with Frank Duke, the county planner, when we come back, so stay with us.
Joining us now are Kenneth and Barbra Jenks, a husband and wife who both have AIDS. They were thrown in jail for smoking marijuana to alleviate the side effects of the AIDS medication that they both have to take. Would you please welcome them both to the show? Thank you very much for coming in today. Let's start out with a little bit of background. When did you how long ago were you diagnosed as having AIDS?
Back in December of '88.
December of '88? And how did you find out?
I'd got real sick. I couldn't hardly breathe. I'd went in the hospital. They had me on a bunch of oxygen machines and stuff, and they had diagnosed me then.
Well, I'm a hemophiliac.
Yeah.
And they, by that, they knew that we were probably infected already.
I see. But you didn't have any idea at all that you were infected?
The doctor told us more than likely we were. He said because another hemophiliac had tested positive, you know, and he'd gotten blood from the same lot.
Oh, really?
Yeah,
So what kind of medication are you on right now?
Oh, we take AZT, we take pentamidine, Nazarol, Diflucan.
So a whole slew of medications. Now, the problem is the medication has side effects, right? Like what? What happens?
Nausea.
You can't eat.
You can't eat.
You just, gosh, some of it you just, you know, it's unreal. It's pretty horrendous.
Some of the medication will cause you to have like aches and pains.
Describe like a typical day for you with the side effects of the medication you're taking.
Well, she would get up in the morning and throw up the first thing.
I'd spend most of my day in the bathroom.
And I wouldn't eat, or we both lost a lot of weight.
Which isn't good. I mean, the more, it's a very dangerous
thing.
She
was down to 112 pounds.
And what is your normal weight?
Before I got sick, I weighed about 150 pounds. I got down to 112 pounds. It jumps up and down. It depends on, you know, if there's anything wrong.
Well, you look good now. Is it because...
Oh, I feel all right now.
Now, who told you about marijuana and the fact that it could help you out with the side effects?
We go to a support group for people that have AIDS, and we had met a friend that had told him and us about, me about the...
He said he smoked pot because, you know, I mean, we told him about some of our symptoms, getting sick and couldn't eat, and he said that, well, he had been smoking pot and it helped. So he gave me some, and, you know, by this time, because we'd tried over half a dozen nausea medicines from our doctor, and either they didn't work or you just can't function.
Now, up until this point, had either of you ever smoked pot before?
I never had.
She never had. I had tried it when I was a kid, but I didn't fool with it.
So what happened? You smoked some pot, and what happened? Did everything change
In about 15 minutes, you know, the nauseated feeling went away, and within an hour, I couldn't eat enough. She couldn't believe it, you know.
I had tried it like the next day, and it helped me with my nausea, and it helped me eat.
Okay, but now at the time, you knew that it was illegal to
Yeah, we did.
smoke
But we
pot,
told
right?
our doctor that...
You did. What did he say?
Well, we told him because, you know, we said, listen, you know, none of these drugs have worked. Well, he knew they didn't because we told him, you know. Because a lot of the bad thing about a pill is that when you're sick and you take a pill, you know, you just throw it right back up.
I see.
And with marijuana smoke, you know, there's nothing to throw up.
So where'd you get the pot?
Wherever we could.
Wherever we could.
Sometimes we
You mean
could.
you're out walking the streets and asking people for pot?
Friends and
friends.
people. That guy we met at the group, he put us in touch with people and just wherever a lot of times we couldn't find it. So that's why we decided to grow our own.
Oh, you did?
Yeah, or sometimes we couldn't afford it.
Now, the audience is laughing right now. But we're going to get to the audience because there are a lot of people who think that you should be able to smoke pot legally as a medication. And we're going to get to that in just a little while. But I want to talk about what happened. You started growing your own pot,
Yes.
and you got arrested.
Yeah.
And they threw you in jail?
For over a day.
How did they find out you were growing pot?
Somebody said they saw, we either bought some from, got busted, and said that they knew that we had some, and or somebody saw it through a window. That was never really clear. You know, we just, one evening the police used a battering ram to come through our door and arrested us.
And did the police know that you were using this for medication at the time?
We tried to tell them.
We told them that we were using it for our own personal use, is what we told them.
So I'm not clear on the law, though. Can you use marijuana in your own home for your own personal use?
No.
It's illegal?
It's illegal.
Okay. But the police came in, they threw you in jail.
Yeah.
And then you went to court, and what happened in the courtroom?
Well, the judge found us guilty of possession of less than 20 grams of marijuana and cultivation, and then he withheld adjudication of guilt, and he placed us on 1 year's unsupervised probation, and he gave us 500 hours community service taking care of each other.
Taking care of each other. Well, it sounds to me like the judge was pretty lenient.
He had a lot of compassion.
Yeah, he was pretty lenient with you, because he could have thrown the book at you, right?
Yeah, he could have.
Now, how much support are you getting from the public about this?
Everybody's been really nice.
Everybody's been real nice to us and supporting us.
Yeah. How about family and friends?
Well, his side of the family, yeah, we get a lot of support from them.
Yeah,
I mean,
we do.
And we really haven't lost that many friends to where it would make a difference.
Now, does your doctor, do you have the same doctor that you had before now? I mean, does he agree with you smoking marijuana?
Yeah, he's helped us to apply to FDA to get government marijuana. It's called an IND, Investigative New Drug, and it took him over a month to fill out the paperwork, and it's been going on 3 months, you know, total since we got the papers. So we're waiting to hear from FDA whether they'll give it to us legally.
Now it must drive you crazy, though. I mean, you know, you seem very calm about this, but it must drive you crazy knowing that you both have AIDS, and you're sick all the time if you don't smoke marijuana, but you know that you can't. What happens if you smoke marijuana again? What's going to happen to you? You're going to get thrown in jail again, right? I mean, you're on probation.
Yeah, exactly.
Well, what will happen?
I mean, if they catch us, we're in violation of probation. So, I mean...
And then what?
They would put us in jail. Probably with full bond.
Which starts a whole vicious cycle, right? Because if you're in jail, then you can't smoke, which means if you can't smoke, you can't eat.
And you get sicker and you lose weight.
Now, when you were in jail, after you got out of jail, didn't you get even sicker? You almost died, didn't you?
She went in the hospital.
No, I didn't. I mean, they had to put me, like, back on the oxygen machine, but I went in the hospital for almost 2 weeks then because of the germs and just...
Yeah, because jail's like a death sentence for someone with AIDS. Because your immune system's already bad, and jails are just filthy.
So, so what do you do now? I mean, if you get caught with pot, you're going to get thrown back in jail, and you could possibly die. But obviously, are you smoking pot now?
That's kind of, yeah, I'm not going to...
The audience doesn't want you to answer that question.
No, we're
okay.
not going to.
But...
we're just trying to survive, I'll say that. That's all.
So, Is there any way that you can get help? I mean, what have you tried to do to get help?
Gosh, there is no help. I mean, basically just other than
for the IND papers to come in, and
I'm not really ever going to feel safe until those are approved.
I see, and that's going to take a long time, you said, up to a year?
Yeah, at least.
At
maybe.
least a year?
Well, we're hoping it won't be that long, but it could be.
Okay, well, we want you to stay right here because we're going to come back and we're going to meet someone who you know. Barbara and Ken aren't the only people who have used marijuana to help with their medical problem. And when we come back, we're going to meet a man who is actually being supplied with pot by the United States government to treat his disease. And we also want to know how you feel about this, so we're conducting a people poll. Here's the question. Do you think marijuana should be approved for medical use? To vote, call 201-480-VOTE, V-O-T-E. Now press Y for yes and N for no. That number again is 201-480-VOTE, V-O-T-E. And we'll be right back in just a minute. Thank you, and welcome back. Joining us now are Robert Randall, who is with ACT, which is the Alliance for Cannabis Therapeutics, and also Steve Rogers, who is a law enforcement officer. Now, Steve, I'm going to get to you in just a second, but Robert, you were diagnosed with glaucoma at age 24, correct?
Yes.
Okay, and you have, well, let's start off by saying, what is glaucoma to begin with?
Glaucoma is a disease of the eye that progresses to blindness if it's not properly controlled. It's the leading cause of blindness in the United States.
Now, when did you start using marijuana?
I began using marijuana for fun in college in 1968. I began using marijuana medically around 1974.
Okay, now, did you know that marijuana was going to help the glaucoma before you started smoking marijuana?
No.
What happened?
There are visual symptoms that you get with glaucoma. When the pressure in the eye gets to a certain level, you begin to see tricolored halos around lights. It looks like light bulbs are having religious experiences. And I happened to smoke 2 marijuana cigarettes one evening while I was having that symptom. 45 minutes later, the symptom was gone, and I could see clearly, and it was fairly obvious that marijuana was being helpful. It's not something that you want to believe initially. I mean, believing that an illegal drug, a weed that grows out of the ground, is going to help you when all the modern pharmaceuticals haven't is a stretch of the imagination. But after about 6 months of trial and error, it was very clear to me that marijuana was helpful. I added it to my medical routine. I did not tell my doctor because it was illegal. And like Kenny and Barbara, I had trouble getting enough marijuana off the black market. First, it's expensive, and second, sometimes it's just not there. So I decided to grow 4 marijuana plants, and like Kenny and Barbara, I got arrested.
You got arrested, but your outcome was completely different than theirs.
The court, in my case, found me not guilty. I went through a number of controlled medical studies. Physicians licensed by the federal government examined my condition. What they concluded was that if I were left on the available medications, I would go blind, probably around 1977. But if marijuana could be added to my use of medications, then there was a possibility my sight would be prolonged. Thankfully, the judge listened to that evidence, ruled that my use of marijuana was a medical necessity. It's a very rare defense. And as a result of that defense, I began receiving marijuana legally from the United States government. I received marijuana...
Wait a minute, hold it, wait a minute. You mean the government supplies you with pot?
Yes, they do. What I found out during the research programs that I was in was that the United States government maintains a small farm in Mississippi. They call it the pot plantation. They grow marijuana there. That marijuana is taken to a rolling factory in North Carolina and rolled into cigarettes. And the importance of that is that, as with any medication, you want a controlled dose. You want to know that the marijuana is pure, and you want to know exactly how much marijuana is in each dose or each cigarette.
Who's this for? Just people like you? People with glaucoma? Because people with AIDS can't get it.
No, it's not even for other people with glaucoma. One of the concerns of the group that I'm with is that the government has consistently attempted to block marijuana's medical use, and it's only through extremely complicated procedures that patients can gain legal access. Right now, there are only 5 individuals in this country who are medical patients who have legal access to marijuana.
But wait a minute, excuse me. You know, I'm confused because there's this farm that the government...
Oh, the farm is for a number of purposes. I mean, the farm...
it's not just for marijuana.
No, the farm does just grow marijuana, but the marijuana that the farm grows is used for a number of purposes. For example, how many marijuana cigarettes does a rat need to smoke before he can't drive? Those kinds of studies are constantly being done. But knowing that this stockpile of marijuana exists means that patients who can go through this complicated procedure at least have a secure source of supply.
Okay, let me move you on a little bit here, because
Sure.
after you getting supplied by the government with marijuana, they told you had to keep it a secret, right? As soon as you went public with it, they took your...
They tried to take it away. They thought that we could play let's make a deal, that, you know, okay, you broke through the system, you figured out how it works, we'll give you marijuana, but don't tell anyone else. And by that time, I had heard from a number of patients, particularly other glaucoma patients. People who have cancer suffer from similar problems to the Jenkses. Chemotherapy and radiation treatments cause patients to become very ill, in some cases desperately, deadly ill. And marijuana can make the difference between keeping that person in chemotherapy with the possibility of living longer, or the person will quit chemotherapy without marijuana.
Okay, now, obviously you're very convinced of the therapeutic benefits of marijuana.
As are my doctors.
And as are your doctors. But I want to introduce Steve Rogers to everybody right now, who is sitting right next to you. Steve, you're a law enforcement officer. I take it that you don't agree with anything that's being said here today.
Well, I certainly sympathize with these individuals. I mean, you have to show some compassion. The problem that I have is that a crime was committed. There are avenues which these individuals can take to get relief of their symptoms. Now, from what I understand, you could get prescriptions for the THC, which is in marijuana. We have a problem where we seem to be always finding cracks in the system, and we allege the government has a conspiracy against groups of people.
So what do you think is going to happen? I mean, what's the big deal?
Well, the problem is that we have individuals around this country who feel that they can legitimately legalize drugs for themselves. I mean, I read an article yesterday where, in the New York Star Ledger, where women who have weight loss problems, doctors are discovering that they're using cocaine. So what are we to do? Allow everyone to do what they want to do without being held accountable for their actions?
Or in the alternative, are we going to sit back and know that marijuana is effective and allow people to go blind?
Bob, we don't know that. There's been no conclusive studies.
Oh, there have been.
There have not been.
There have been.
Okay, wait a minute. Let's get the audience involved in this, okay? Matter of fact, let me ask just a question in general of the audience, okay? Do you think that if you were suffering from a disease that you knew that marijuana could help alleviate some of the symptoms, even though you knew it was illegal, would you take it? If you would, applaud now. You would?
Irregardless of what that Nazi had to say about it.
Now wait a minute. Now that's a little harsh.
Well,
he's a law enforcement agent.
I understand.
Okay, now wait a minute. I want you to think about what he has to deal with. He deals with the criminals out there every day.
Okay.
His life is on the line every single day.
I understand.
Can't you understand why
Yes,
this man wouldn't want to have pot legalized in any way whatsoever?
I think it's a crime to keep a medicine from the people of this country that we know works. My name is Darren Federer. I'm from the National Organization of the Reform of Marijuana Laws, and we're for the repeal of marijuana prohibition.
Okay, well, we're not talking about that yet. We will talk about reforming the marijuana laws in the next segment, but right now we're talking about for medicine only. And I'm sorry, we're going to take a break, but we will come back and we'll talk to all of you, and we'll continue our discussion in just a minute. Stay with us.
The state of Florida is #1 for the increase in heterosexual AIDS cases in the United States now.
Leon Vicker, the executive director of BASICS, a local AIDS support group, agrees this means women have become a large part of the AIDS population.
The reason, again, is just ignorance. People are not paying attention to what causes the disease. They're still tagging it as a homosexual disease or an IV drug user's disease, and they're not having protected sex.
Even though the number of diagnosed AIDS cases in Bay County seems to be low, BASIC warns that the greater fear is there could be 500 people who have the virus and don't even know it.
If those people would come in and get tested, especially like on women, you know, if they would come in and get tested and forget the fear and just do it.
Barbra Jenks understands the effect of AIDS on women. She contracted AIDS from her husband, who was a hemophiliac.
The fear that I went through, I didn't want to know that I had it, but I knew I had it.
Rosalind Chandler, a registered nurse and volunteer at Basics, has witnessed the fear of women with AIDS.
Women and men kind of have the same problems with this, that either one, there's a fear of what's the rest of my life going to be like.
You could either die with AIDS or you could live with AIDS. And I'm living with AIDS. I'm not dying with AIDS.
Natalie Moultrie, 13 Eyewitness News.
We haven't gotten our legal marijuana, and I don't understand why it should take so long. You know, the doctor clearly knows it works, and, you know, I mean, I don't understand why you can't just sit down and write a prescription.
Late last week, the Food and Drug Administration ruled that Ken and Barbra Jenks can smoke marijuana to alleviate the symptoms associated with AIDS. The Panama City Beach couple now awaits word on their final hurdle, permission from the Drug Enforcement Agency. Last August, the Jenks were found guilty of possession and cultivation of marijuana by Bay Circuit Court Judge Clinton Foster. The couple testified that the pot helped alleviate the nausea associated with the treatment of AIDS. A half year of national media attention to their arrest and trial, Ken and Barbra feel their case may help others in similar predicaments. Ken and Barbra Jenks both say one of the most important things for them now is to get a pardon from the governor's office. They say their approved use of marijuana by FDA should help in this regard.
Because we're not a criminal. We just do it to hurt anybody. We were doing it because we wanted to survive in this world and live a little longer.
If the Jenks are not pardoned, the District Court of Appeals in Tallahassee will hear their case early next year. Mike Ruspan, 13 Eyewitness News.
We were real happy about it.
Would have been nice to have as a Christmas present.
Yeah.
I mean,
but
we didn't, so we're still waiting.
It's been almost a year since Ken and Barbra Jenks were arrested for possession of marijuana, and since then, their struggle to get it legally has been a long and uphill battle. The Jenks say smoking marijuana helps relieve the nausea they get from taking so many drugs, plus it helps increase their appetite.
It was taken away from us.
I lost 14 pounds in 2 weeks.
And I ended up in the hospital, and I lost some weight. I went from 132 down to 118.
Even though the Jenks have been approved by the Food and Drug Administration to get marijuana as a prescription drug, they must now get approval from the Drug Enforcement Agency, and that could take weeks or even months.
To get the medicine that we need, you know, it'd be nice not to have to wait any longer.
Long waits have been common for the Jenks. It took 3 tries and 14 months before Ken was approved for Social Security.
As far as my Social Security and everything else that's happened, I mean, it's taken so long. After a while, you just can't have the feeling, except that they're hoping you die and go away.
Yep. A sick person shouldn't have to go through all the paperwork that they do have.
It's amazing.
I mean, because all it does is just put more stress on you. And
dealing with stress is something the Jenks have learned to deal with day by day.
Yeah, we do. We just try to have a good time, you know, and
by loving and caring for each other. I mean, we always have. We've dealt with our problems. I mean, we've accepted that we have the disease, and we've accepted that we were arrested. And
exactly. Now we're just living with it.
Now we're just living with it. We're not dying with it. There's a big difference.
Exactly.
Having a positive attitude about it there's a big difference.
It became a part of our lives. We didn't become a part of it.
Natalie Moultrie, 13 Eyewitness News.
Tonight. A Panama City Beach couple, both infected with the AIDS virus, have federal approval to legally use marijuana to treat their disease. But Barbra and Kenny Jenks say drug enforcement agents are keeping them from getting the drug. Today, a Washington, D.C.-based patients' rights group appealed to the U.S. Attorney General to intervene on the Jenks' behalf. Reporter Hank Woolard has their story.
Kenny and Barbra Jenks are like many young couples, with one big exception. They're both dying of AIDS. The Jenks found that smoking marijuana provides relief from many symptoms of the disease, and they were busted for illegal possession of the drug last year. Their trial attracted national attention. They lost in court, but in December they won FDA approval to use marijuana legally. The Drug Enforcement Administration also approved it in January, but the Jenks are still waiting.
Oh, I think it's ridiculous. I mean, we've been waiting for 2 months now.
All they have to do is pick up the phone and call NIDA, and they ship it right to our pharmacy. And I don't understand, you know, what can be the holdup.
The Jenks bide their time. They keep each other company, play with their 3 dogs, and Kenny is fixing up this old truck to sell to pay off some bills. They say they try not to succumb to anger over the government red tape that keeps them from their medicine.
Seems to me like they're deliberately stonewalling. I mean, you know, I thought it might be red tape a couple, 3 months ago, but I mean, you know, how much red tape can there be?
A spokesman for the DEA said he was not familiar with the case and does not know why the Jenks have not gotten their drugs. Despite a lot of unexpected setbacks, the Jenks remain cautiously optimistic about getting the drug. The question now is when. Hank Woolard, 13 Eyewitness News.
The Jenks are currently appealing a criminal misdemeanor conviction for the possession of marijuana. The couple believes the FDA approval of their legal use of pot could have a bearing on the case, but they say the higher court has not yet ruled.
Good evening, everyone. I'm Kathy Oliver. After months of wondering and waiting, a Panama City Beach couple with AIDS may finally get not only their wish, but what the Federal Drug Administration had long promised them. FDA awarded the Jenks permission to use marijuana to reduce their AIDS-related nausea, but that was 2 months ago, already months after they had been arrested for using it on their own. Many people rallied for Ken and Barbra Jenks, and the couple is thankful for that help. They say it may be part of the reason the DEA and FDA finally cut through all the red tape. They were contacted yesterday and told a shipment would be ready sometime this week. Even so, the Jenks say they will believe it when they see it. Though they are extremely happy, they say they've heard it all before. Well, this morning's farewell to the 140
gimmicks to attract tourists, but nothing quite matches the enormity of the roadside attraction that John Holden has found. It should have become extinct a long time ago.
The legal battle for a beach couple suffering from AIDS is finally over. Ken and Barbra Jenks got their first shipment of marijuana this week. The FDA approved it several months ago, but another federal agency held up the shipment. The Jenks say they need the drug to relieve nausea and maintain a good appetite, which is diminished by the AIDS virus.
People know that they can apply if after finding a doctor willing. And that they, you know, maybe they can do that and not have to be arrested and go to jail and go through all that.
The result of their case is that doctors and patients have become aware of that. And it's that awareness that there is a way that I think will accelerate the number of requests to the federal government.
The couple will get 150 marijuana cigarettes each month for free. Now the couple's next battle is in the Florida Court of Appeals on Monday. They want their drug conviction thrown out. Ken Jenks got the AIDS virus from a blood transfusion. He passed it on to his wife.
Coming up tonight, we'll talk about
Good evening. A Panama City couple found guilty of marijuana possession just 11 months ago can now smoke the weed legally. TV7's David Reinhardt tells us the couple who suffers from the AIDS virus will now get relief thanks to Uncle Sam.
You're looking at perfectly legal marijuana, and it belongs to Ken and Barbra Jenks. In March of last year, they were busted for smoking pot, but now Kenny and Barbra can get it by prescription from the government for free.
Yeah, you don't have to worry about if I run out or if I can't afford any or can't find it.
Not just anybody can get legal marijuana, but you probably don't want to go through what the Jenkses have gone through. Kenny and Barbra both have AIDS. The disease and the medication for the HIV virus produce nausea, vomiting, and weight loss. They say the government pot will be used to reduce the symptoms, not to get high.
When you're smoking a good bit of marijuana, you don't really get a buzz. You feel better, and you have an appetite, and that's
Controls
and it keeps you from walking around feeling like you're just about to throw up.
Along with Barbra and Kenny was Robert Randall, the president of the Alliance of Cannabis Therapeutics. Randall receives medicinal marijuana for treatment of his glaucoma. He said in trying to get their own marijuana, Kenny and Barbra Jenks have gone through the red tape for way too long.
Unfortunately, when I called DEA in Tampa in December, after the FDA had approved Kenny and Barbra, and asked them to expedite delivery, which means they can waive the paperwork, deliver the product, and then get the paperwork later on the other side. DEA simply refused to do that. Now, I don't know why DEA refused to do that.
Kenny and Barbra Jenks are only the third and fourth persons in the country to get marijuana prescribed to reduce the symptoms of AIDS. Now the couple is fighting to appeal their earlier conviction on pot possession. That case goes before the District Court of Appeals next week. In Panama City, David Reinhardt, TV7.
Tallahassee this morning, the highly publicized case of a Panama City Beach couple was heard at the 1st District Court of Appeals. As you may remember, last year, Ken and Barbra Jenks were arrested and found guilty on a marijuana possession charge. At the time, the Jenkses testified in court that the drug helped to alleviate the nausea associated with treatment of the deadly disease AIDS. Then last week, the couple learned that they would be two of only a handful of people all across the country given federal permission to smoke marijuana. This morning, the Jenks' lawyer, John Daniel, disagreed with trial judge Clinton Foster's opinion that the case does not warrant a medical necessity defense. The Court of Appeals' 3 judges did not indicate when they'll render their decision in this case. Today in court, an agreement was reached in the case of a woman charged with delivery of pornographic material to a minor.
AIDS patients. NBC's Dr. Barry Kaufman reports on the local couple, Kenny and Barbra Jenks, and their efforts to help other patients with AIDS.
I went from 155 pounds to down to about 112, 114.
Barbra Jenks and her husband Kenneth both have AIDS. As a hemophiliac, Kenneth Jenks had apparently contracted AIDS from a blood transfusion, then unknowingly passed it on to his wife. A major complication for both of them was weight loss, until other AIDS patients began supplying them with marijuana.
My wife was reluctant to try it, but I tried it that evening, and after 20 minutes, you know, I felt better. I didn't feel like I was about to throw up. And within an hour, I mean, my appetite was unbelievable. I couldn't get enough to eat.
The Jenks now receive marijuana cigarettes legally from the federal government, but they learned about the legal program only after suffering a traumatic arrest for growing 2 pot plants in their Florida trailer home.
There were 10 or 12 policemen with shotguns and, you know, pistols waving in the air, and they held guns to our heads and handcuffed us and hauled us away to jail.
Right now, the Jenks are now involved in letting other AIDS patients know that their physicians can get marijuana legally. The process takes from 3 months to nearly a year, but Marijuana AIDS Research Service Director Robert Randall hopes that process can be shortened. It's not the perfect solution, but we hope that we can help AIDS patients gain legal access to marijuana before they're arrested for using it off the streets. The marijuana comes from this government-run farm in Mississippi. The cigarettes are rolled in North Carolina and then distributed to research facilities and patients. So far, only 3 AIDS patients are signed up legally, but Randall estimates illegal use is much higher. Between 40 and 50% of patients who have advanced HIV infection appear to be using marijuana. AIDS service groups and hospital representatives say the marijuana treatment may be something their AIDS patients can use. Lisa Laughlin and Linda Taylor are AIDS testing center counselors.
It's another piece of hope that we can offer these people. I mean, anything that's going to help us tell these people that they're positive and give them some kind of hope is helping us, too.
Barry Kaufman for NBC News.
Meanwhile, CBS's 60 Minutes crew was in Panama City for 2 days this week, documenting the plight of Ken and Barbra Jenks. Panama City Beach couple inflicted with AIDS recently won approval for the use of marijuana for medicinal purposes. 60 Minutes correspondent Morley Safer reportedly interviewed the Jenks and their attorney John Daniel, as well as former Drug Task Force members Dale Smith and Tom Harris. Back we go out to grew 2 marijuana plants and used the drug to relieve nausea brought on by the treatments they were taking for AIDS. Today, the Jenks, the head of a national patients' rights group, and the couple's attorney met with the local media to discuss the impact of that landmark ruling. TV7's Rex Ogburn was there.
This was the first ruling in the country by an appeals court that marijuana is a drug of medical necessity for AIDS patients. And National Patients' Rights Group leader Bob Randall said the Jenkses, by going public and winning their case, had done a lot to clear the way for other patients of AIDS or other deadly diseases to get relief from the drug and to change what is a very bad and archaic system and attitude.
That the medical prohibition is beginning to disintegrate. It has no public support. It has no support within the medical profession. And I think that there's beginning to be a groundswell of political demands for that system to change, which I think is good news. The DEA policy is inhumane. The DEA knows it's inhumane and insists on maintaining it. But I think cases like Kenny and Barbara's really help the public to understand that seriously ill people can benefit from marijuana.
Randall and the Jenkses had high praise for attorney John Daniel, who handled their case free of charge, and for their Pensacola doctor, who overcame a mountain of paperwork and 3 federal agencies to get the couple prescription marijuana cigarettes from the federal government. This case also helped to give birth to a new nationwide group, Marijuana AIDS Research Service, based in Chicago. The group is now beginning to counsel AIDS patients across the country on what is available as a result of the Jenks case. The couple has been named honorary co-chairman. The Jenks case may have already had an effect here in Bay County. Seems a chemotherapy patient caught with marijuana recently has been put in pretrial intervention, which basically means she won't be prosecuted if she follows certain rules for a certain time. By the way, Ken says those free, legal federal marijuana cigarettes that he and Barbara get do the job, but they're lousy. He could grow better stuff himself. Rex Ogburn, TV 7 News.
Well, the city of Lynn Haven.
We all share the same. June of 1981, a doctor published a report of a fatal condition that mostly afflicted homosexual men. Well, that disease became known as acquired immune deficiency, AIDS for short. And over the last 10 years, AIDS has killed millions worldwide. 2 of the most well-known people with this disease live on Panama City Beach. And reporter Mike Gershban says the philosophy of Ken and Barbra Jenks is to live each day to the fullest.
Over recent months, Ken and Barbra Jenks have been on the national television and radio talk show circuit. They're the first people to be granted permission by the federal government to smoke marijuana because they have AIDS. For them, the drug alleviates nausea associated with AIDS treatment. Last April, the state Supreme Court overturned their 1990 conviction on marijuana possession. 29-year-old Ken Jenks is a hemophiliac. He believes he contracted the disease from a bad batch of blood in the mid-1980s. Before knowing he had AIDS, Ken transmitted it to his wife, Barbara. Both say they were emotionally devastated after learning that they had the disease in 1989, but now they say a positive mental outlook is the most important factor.
When you wake up in the morning, it's kind of refreshing knowing that you're there still.
You've made it another day.
Yeah, you made it another day.
And where if you don't have the disease, you take life, a lot of life for granted.
For Ken and Barbara, the concepts of the future and time itself take on new meanings.
Quality of life is a lot to do with it. Nobody knows how much time they have. And quantity is something I just don't try to think about. But quality is. I mean, I try to make each day to have as good a time as I can. Because nobody knows how much time they have left.
Mike Ruspan, 13 Eyewitness News.
Next fall, Ken and Barbra Jenks will be the subject of a network news magazine program. Panama City Beach couple who had depended on marijuana to relieve symptoms from the AIDS virus. It seems the government shipments of the drug have stopped. The FDA has been sending marijuana to Ken and Barbra Jenks for the last 4 months. But today, the Jenkses found out that supply might have been cut off. So far, FDA officials have not contacted the Jenks. The couple says without their marijuana, they will not be able to function.
And they didn't, the thing is, they didn't notify our doctor or anyone. They just didn't send it. For whatever reason, I don't know if they have a reason other than they just didn't do it. I can't understand why they would do such a thing. It's really outrageous that they would withhold our medication.
Apparently, some other people who've used the government-supplied drug doses have also had a delay in their shipments. The Jenks' doctor and pharmacist are trying to find out why there's a holdup.
There's a major setback tonight from Washington, D.C. on the use of marijuana as medicine. According to a published report in this morning's Washington Post, no one else will get legal permission to smoke pot to alleviate symptoms of a number of different illnesses. The Food and Drug Administration made its decision public yesterday afternoon.
The first indication that something may be wrong came earlier this week when Kenneth and Barbra Jenks ran out of marijuana.
they did not receive a new shipment from federal authorities. The Jenkses were approved to smoke pot for symptoms of their illness, AIDS. The Panama City Beach couple's fight to get legal permission to smoke marijuana for nausea and lack of appetite gained national attention. At least one man thinks the FDA and the DEA are trying to send the Jenkses a message.
And I think what the government did by trying to disrupt Kenny and Barbara's access was make them insecure and make them think twice before they spoke out on behalf of those patients who were being denied care.
Kenneth and Barbara Jenks agree.
I think one of the reasons is because we're so outspoken, but I feel obligated to. If we went through so many drugs that did not work, that when you do find a drug, even if it is illegal, you need to tell other people. They need, especially with AIDS, they need to know this information.
After the Jenkses received permission to use marijuana for their AIDS symptoms, the federal government was bombarded with applications from AIDS patients. The Marijuana AIDS Research Service helps AIDS sufferers process those applications. Right now, they say only 3 out of 34 people approved to use pot legally in the United States have AIDS. The rest are cancer and glaucoma patients. About 200 AIDS patients got the word that they were approved to receive marijuana, but now those approvals are apparently void. And what about Kenneth and Barbara Jenks?
I don't know for sure. They say that they're still going to try to continue to supply the people they are already. Now that to me doesn't sound very concrete.
Robert Randall with the Mars organization says his group is looking at legal options to challenge the FDA's decision. Kenneth and Barbara Jenks say if the government is trying to keep them quiet about therapeutic marijuana use, it didn't work.
We pay more for our garbage in our incinerator than people in New York.
Also, we'll have more on the different ways people are smuggling cocaine these days.
Also tonight, we have some very scary proof of just how dangerous fireworks can be. Those stories next on 13 Eyewitness News. 13 Eyewitness News is having a life prayer come true. Ken and Barbara Jenks no longer fear that they will go to their graves as criminals. Reporter Mike Gerspan says the Panama City Beach residents have now officially been vindicated on marijuana charges.
The judgment of not guilty is entered and the defendants are discharged.
Thank you, Your Honor.
Clerk will file the order in the file.
Let's go.
Ken and Barbara Jenks have long sought those words from Circuit Judge Clinton Foster. Earlier this year, the Florida Court of Appeals and State Supreme Court upheld the Panama City Beach's couple's defense that medical necessity led them to break the law to stay alive. The Jenks, who suffer from AIDS, use marijuana to overcome the effects of the deadly disease. But last year in Bay County, they were convicted on marijuana cultivation and possession charges.
I'm glad it turned out the way it did. You know, if we had to get AIDS and all that, at least, you know, what's happened to us will maybe possibly benefit other patients and, you know, make it easier for them. That's the best part.
We all worked hard on it.
Yeah, we did.
Mike Gerspan, 13 Eyewitness News.